Well, good afternoon, everyone. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, I would like to welcome you all to our December monthly webinar. Today's topic is HPV vaccine trends and role of the dental provider in HPV vaccination, gaps and opportunities for cancer prevention, presented by Dr. Christina Demopoulos and Dr. Shilpa Naval. Today's presentation will be recorded and placed on the TechSoc website the first part of next week. Today's presenters are Dr. Christina A. Demopoulos, who is a faculty member at the University of Nevada, Las Vegas School of Dental Medicine. She attended the University of Nevada, Las Vegas for her undergraduate and her Master of Public Health training. She received her dental degree from the University of Southern California and her dental public health training from the University of Texas Health Science Center at San Antonio. Dr. Demopoulos is a course director for several classes at the UNLV School of Dental Medicine and provides educational experiences relating to HPV and oropharyngeal cancer. She has collaborated with the Nevada Statewide Immunization Coalition, the Advanced Health Education Center, the American Cancer Society, and the National Network for Oral Health Access to offer continuing education webinars relating to the promotion of the HPV vaccine for healthcare providers. She has also presented on this topic at local, state, and national conferences. Our second presenter is Dr. Shilpa Naval. Dr. Naval is an assistant professor and a health services researcher in the Department of Dental Public Health and Policy, Virginia Commonwealth University School of Dentistry. She is a board-certified diplomat in public health dentistry and serves as a faculty member in the VCU I-Cubed program and Phillips Institute for Oral Health Research. Her primary research interests are in dental medical integration, oral health disparities, access to health care, and the use of health services among vulnerable populations. As an associate member of the Macy Cancer Center at VCU, her cancer prevention work focuses on addressing oral cancer and screening disparities and examining risk factors, including HPV, HPV vaccination, and tobacco use. Dr. Naval is actively involved in various national and state level oral health policy and scientific committees, and she currently co-chairs the Council of Scientific Information at the American Association of Public Health Dentistry. I'm excited to turn this over to Dr. Demopoulos and to hear their presentation.
Perfect. Can everybody see the screen okay? Wonderful. Well, thank you everybody for joining the session today. I will begin the introduction and some of the background for HPV. Then I will turn it over to Dr. Naval. And at the end, we've left room for questions and answers and hopefully some discussion on what you may be doing in your respective work environments in your cities or states. So today's topic, as Beth mentioned, was related around HPV vaccine and the relationship with oral health. But more specifically, we're going to talk about one of the projects we did or we're working on with the CareQuest Institute for Oral Health. We want to tie it all in together. So as a disclosure, we have no actual or potential conflicts of interest in relation to this presentation. We did work with the CareQuest Institute for Oral Health, as I mentioned, specifically on the one project Dr. Naval will talk about. So we worked with Julie Hawley, Abby Kelly, and Eric Trendy. So the learning outcomes for our session today, we want to learn about HPV vaccination trends in the US and compare them with Healthy People 2030, and perhaps have some discussion on how we can actually better reach these goals across the nation. Describe the relationship between HPV and oropharyngeal cancer and the role of the HPV vaccine and disease prevention, and more specifically, what we as dental providers or public health professionals can do to help increase the uptake of HPV vaccines. Discuss the findings of the CareQuest Institute's State of Oral Health Equity in America survey as they relate to HPV and the HPV vaccine. So I will go ahead and begin a little bit with a background in epidemiology for HPV. So many of you know that the cancers of the head and neck occur in a lot of different areas. If we're in the dental profession, if it's dental hygiene, dental assisting, or dentistry, we do the comprehensive oral cancer screening. We look at the entire mouth. And why that's important is because a lot of these cancers may not just present on the tongue or the front of the mouth. We do have to look in the more posterior area. So you can see on the slide, these are cancers in the mouth or the oral cavity, the pharynx, which is a little bit further back, as is the larynx, as well as the paranasal sinuses. There are also cancers that may start off in the oral cavity that migrate or transgress into nasal cavity or even salivary gland cavity, different types of cancers. So more specifically for oropharyngeal cancer, which is the oropharynx, I want you to look at the blue diagram that says oropharynx. It's in the most posterior part of the mouth. So when the dentist or dental hygienist does the comprehensive oral cancer screening in the dental chair or in a community clinic, wherever it may be, they really do have to look in the most posterior part of the mouth. So the cancers more specifically related or associated with HPV do occur in the most posterior part of the mouth, which is slightly different than the cancers that we may have attributed to tobacco or alcohol, which can appear in the oral cavity, which is the most anterior part of the mouth. So you can see with oropharyngeal cancers, it's the back of the throat, the base of the tongue, and the tonsils. And these are the more common areas for oropharyngeal cancer, but more specifically, as we'll talk about the incidence with men, males tend to have a higher rate of HPV-associated oropharyngeal cancer. So with the human papillomavirus or HPV, it's a common infection. Almost everyone will get HPV at some point in their lives. Most HPV infections clear by themselves, but some can stay or last longer, which means if you have a healthy adult, young adult, or older adult, whoever it might be, if our body is healthy and we don't have any other complications or we're not immunocompromised or have other concerns, we tend to clear the infection within 1 to 2 years. So a lot of people may not even realize they have ever been infected with HPV if it actually has cleared and they never developed any symptoms. The high-risk HPV strains can cause genital warts and certain types of cancers, which can also manifest in the oral cavity. Approximately 36,000 cancer cases are caused by HPV every year. We're going to talk a little bit more in a couple slides on what the incidence is for males and females. HPV causes nearly 90% of cervical and anal cancers, and about 70% of these are oropharyngeal cancers, which is why it's important for us to start talking about this in relation to dentistry and health promotion, because a lot of these are the types of cancer that we would see upon routine exam in the dental setting. So the natural history of HPV, it is a serious problem. Like I mentioned, it can cause warts and certain types of cancer. And in a regularly healthy or patient that might be healthy, within 1 to 2 years, they will clear the body, as I mentioned. But there are those, the high-risk strains that we do find in the oral cavity that we'll refer to as oral HPV. These will actually arise in the oral cavity, and if not caught early, can actually become oral cancer or maybe even further on to oropharyngeal cancer, depending on the location. So with this slide, I wanted to talk a little bit about how common HPV is, and you guys probably have heard this or read about it in the literature, but HPV is one of the most sexually transmitted infections and the leading cause of oropharyngeal cancer. So if we're in a dental setting talking to patients, especially parents of pediatric patients, it may be an uncomfortable conversation to have just because HPV is, a sexually transmitted infection. Not everybody gets it in that way, but if they do, it's a very, very difficult conversation to have with our parents of the pediatric patients and maybe even our adult patients in itself. So that's why we have to start these conversations early and talk about more cancer prevention and what we can do in a dental setting or community setting to really help engage our community partners and the patients in our patient pool to get that vaccines early on. So about 12,000 people between 15 to 24 are affected by HPV every day. This results in about 26 million people with oral HPV. So you can see how common it is. And about 2,600 of these cases are HPV 16, which is the one that we most commonly see in the mouth. And the 9-valent HPV has the potential to increase oral cancer prevention from 70% to 90%. And it is approved for both boys and girls. And we'll talk about the dosing of the 9-valent in a couple slides. So a little bit about HPV and oropharyngeal cancer. Oropharyngeal cancer and oral cancer is the 8th most common cancer among U.S. males and the 13th most common among females. So we group this together, even though we know and the research shows that HPV-associated cancers are usually oropharyngeal cancers in the most posterior part of the mouth, like I said. But a lot of times in the literature, you'll find that they group oropharyngeal cancer with oral cancer. So that's how this finding is grouped in the literature. And overall 5-year survival rate is about 65%, and there are disparities within that survival rate. About 10,850 deaths from oral cavity or oropharyngeal cancer occur, which is about 1 person per hour, per day, per year, which is quite a significant amount of the population that could potentially pass away from something that could have been prevented. HPV positive oropharyngeal cancers have been rising, definitely the last several years. We'll talk about that in a little bit, how the oropharyngeal cancers are ranked very high right now, especially those related to HPV. Oropharyngeal cancers have surpassed cervical cancer as the most prevalent HPV cancer. And the signs and symptoms of oropharyngeal cancer may not even be symptomatic in some patients. So these signs and symptoms are very similar to the tobacco-related oral cancers, but in some ways they're slightly different because it could appear in the most posterior part of the mouth. So it could be more related to difficulty swallowing, maybe pain or discomfort with swallowing, or difficulty breathing because maybe the oropharynx is shortening or getting smaller. So no routine screening test is available. So that's why it's very important to start educating the families very early on. It's not like the pap smear where they can go in every year and get a routine screening for oropharyngeal cancer. And the HPV vaccine is prevention. It is safe, it's effective, and it's one of the best ways we can combat the disease in the medical and dental profession across all other disciplines too. So with this one here, I mentioned before, I wanted to talk about how we have different numbers of cases, or I guess the incidence and prevalence of the disease amongst males and females. So about 3,500 new cases per year are found in women, and about 16,200 cases per year for men. So you can see it's a higher risk for males than it is for females. And in the top right, you can see over 19,000 cases on average per year are found in areas where HPV is located. But that doesn't necessarily mean that 100% of them are associated with HPV. The second one shows you that about 13,800, or that 70%, are probably caused by any HPV type. And at the very bottom, more specifically, 11,865, or 60%, are associated with the 16 and 18, which are the two strains that we most commonly see in the oropharyngeal cancer in the mouth. This one here is another diagram from the CDC. I want you to look at the, you can see my pointer, I guess, the arrow next to oropharyngeal cancer for females, and at the bottom, the arrow for oropharyngeal cancer for the males. The darker blue color here represents those types of cancers that could be associated or caused by 16 and 18. I want you to also see the lighter blue color. I'm going to point to the top one, which is a little bit larger for you to see. These are caused by 31, 33, 45, 52, and 58, which is why the 9-valent vaccine is so critical or so beneficial to the community, because not only will it protect the population from HPV 16 and 18, but it can also help with some of these substrains that may not necessarily be as common or as prevalent in the oral cavity. This one here, the slide looks a little busy, but I wanted you guys to look at one of the newest slides from the CDC, and you can see that there is a racial, ethnic, as well as a site-specific disparity amongst HPV-associated cancers in general. On the left, you can see with oropharynx, the males have a higher risk for oropharyngeal cancer, but across the board, you can see over here with the green, women do. So the incidence of any type of HPV-associated cancer, there's a higher risk for women because of the cervical cancer that they've been, diagnosed with. And then on the far right, you can see again, there happens to be a racial ethnic disparity, with the highest rates being men and women, white men and women, and the lowest rates being Asian Pacific Islander men and women. So there is a gap in some of the educational opportunities that are out there. We have to make sure that the education we provide is very culturally appropriate, so that we make sure we're getting to the right populations that may have more of a risk for some types of cancer, specifically our discussion is HPV oropharyngeal cancer. So a little bit about the vaccine. So according to the CDC, the vaccine has been demonstrated to be safe and effective, as I mentioned. The safety of Gardasil 9 was evaluated in approximately 13,000 males and females. So the most commonly reported adverse reactions, which is similar to other vaccines out there: injection site pain, swelling, redness, and headaches. Every once in a while, there might be something a little bit more serious, but the literature doesn't really show anything significant or anything of concern. It really is a very safe and effective vaccine to administer. Most benefit to complete the series before the initial exposure to the HPV infection, which we'll talk about in the next slide. And the number of doses in the time period has changed slightly just because some of the more current findings and the uptake of younger children and their immune response to the vaccine. So with this one, you can see that the 9-valent targets the 9 risk strains. The vaccine has been routinely recommended for adolescent females since 2006 and males since 2011. And in the literature, you probably have read or maybe have heard on the news or some of these CDC reports that come out that in 2018, the FDA approved to expand the HPV vaccine among women and men up to 45 years of age. So this is one of those discussions we have with healthcare providers to see if there's a benefit for the actual person. And I know a lot of times we have the question, well, if I've already been infected or exposed to HPV, can I still have the vaccine? Remember how we talked about the 9-valent vaccine? So if you have not been exposed to a certain strain, you can still have some benefit, but that's that discussion we have with our healthcare providers to weigh any potential, I guess you could say, benefit to the older population, but the research is showing that they can still have some benefit. And the schedule and dosing, you can see early from 9 to 10, meaning people can start, or young kids can start from 9 to 10, which is 2 doses. On time, which is what the CDC is recommending right now, because we're grouping it with other types of vaccines at well checks. It's 11 to 12 for 2 doses. Late is 13 to 14, but at this point, they can still only have 2 doses. If they wait until 14 years of age, they're back now to the 3 doses, which was what was recommended just previously, about a year and a half ago. So this one breaks down the same information, just slightly differently. So we do recommend the vaccine for 11 to 12, as I mentioned, but there is also a period for makeup, I guess you would say. If they have not been vaccinated early, we can go up to 26 for the males or 26 for females, I apologize, and 21 for males. And then also you can see at the age of 15, we go back to the 3 doses, and even for the older adults, we'll have to discuss those dosing schedules with a primary care physician. So a little bit about the vaccination rates. You can see we talked about the vaccine as cancer prevention. This is one of the pamphlets that they were promoting the vaccine in various community events, which is, I think, very beneficial. I'm sure a lot of you have also seen some media campaigns on TV, as well as the print media here that is available to family members. So with this one here, it's another document from the CDC talking about how cervical cancer is a screening and there's prevention involved. At the very bottom right, you can see about 90% of cancers are caused by HPV are preventable through the vaccine. So it may be a difficult conversation to have related to how our child may have been exposed to HPV. It's a little easier conversation to say that if we do have this vaccine at the right interval and the right dosing schedule, the parents are going to feel a little bit more comfortable knowing that the vaccine has been beneficial at preventing the cancer in their children. And I'm sure the children will greatly appreciate that too. So the next couple slides before I turn it over to Dr. Naval, I wanted to talk about the vaccine rates or vaccination uptake rates. This is the one we have in Nevada. The last one that Immunize Nevada had was in 2018 from the National Immunization Survey. We break ours down by age, which is 13 to 17, as well as girls and boys, or males and females, I guess you would say. So for our girls from 13 to 17, the last reported survey had 49% were up to date. So either the 2 or 3 doses, depending on when they started, which is just shy of the 54% for the US national average. And that for the younger girls, 13 to 15, is just a little bit lower, 48%, which is kind of in alignment with the CDC, with the national average. I apologize for that. Now, the boys are at 52.7%, which is slightly higher than the US, which is good. We've had a lot of campaigns in Nevada trying to promote the vaccine amongst boys and girls, but the research is showing that it has worked very, very well for the boys, and a 52% from 13 to 15 years old for the boys, which again is slightly higher than the US average. But on the far right, you can see how the Healthy People 2020 target and 2030 target was 80%. So even though we've made some upward trajectory or upward swings in the uptake of our children, it's still not quite where the 80% Healthy People 2020 and 2030 benchmark is. So we have a lot of work to do. This is the information that Dr. Shilpa shared from Virginia. They've been doing very well with their campaigns. This is the 2020 data for males or boys from age 13 to 17. Theirs was 48.2% up to date for their vaccines, and females are 64.8%. So they're doing very good. They've had some upward trajectories also. A lot of this is different campaigns, different information is being made available. And then for Texas, I wanted to share, or we wanted to share some information for you, since many of you are most likely in Texas. So in 2016, less than 1/3 of adolescents were up to date from 13 to 17. So there's a little bit of homework for us all to help educate the community. Adolescents, HPV coverage in Texas has been increasing over the past decade, but it has some disparity amongst the different groups or the different regions in the state, which I wanted to share on the next slide. By last year, the percentage of Texas adolescents who had received at least one dose of the vaccine was 10.6 percentage points lower for females and 11.7 percentage points lower for males on the national average. So not quite where the national average would be. And Texas ranks 47th in terms of the up-to-date vaccine out of the 50 states and District of Columbia. This next slide, I wanted you to see how in 2016, the uptake in El Paso County was 66%, which was higher than every state in the nation except Rhode Island, which is good news for El Paso County. Only 24% of teens in Dallas County, on the other hand, had up to date. So Dallas County not quite where El Paso was. In both the US and Texas, males were less likely than females to be up to date on the vaccine. And nationally, teens living in an urban area were the most likely to be up to date, most likely because of having access to certain providers or at least availability to access a provider. So you can see that I think Texas is doing well in some areas, but just like Virginia and Nevada, we all probably have some homework to do to get us up to the 80%. So this one here is kind of similar to what I said before. You can see in the far right diagram, as of 2017, the uptake for dosing for males and females has been steadily increased. And so we started off kind of slow, but I think over the last decade or so, we're doing great at educating the people and the community. So HPV vaccine, like I said, can prevent 90% of the cancers. So you can see how with the uptakes going up, we can have a greater impact on society and the community in terms of prevention. So I will turn it over now to Dr. Naval to share the findings from the survey.
Thank you, Dr. Dimopoulos, and thank you for setting up the stage from the background and kind of understanding of where Texas stands, how it compares with other national averages and other states nearby. So now I'm going to talk about the study that we've been working on together with CareQuest, and in terms of understanding how and what adults think about it. We've been kind of thinking about how providers, what can they do, but there are barriers for providers. So listening and understanding the point of view of adults in our nation is important to kind of see where the synergies are and where is more work to be done. Next slide, please. So this survey was designed by CareQuest. Data was collected during January and February of 2021. And the data collected is nationally representative of all US adults age 18 and above. They used a MeriSpeak panel, which is a probability-based survey, again, kind of representing the US population. Next slide, please. So in this survey, randomly, as a probability sample size, a randomly selected US household were used, and then they were contacted by mail or telephone, and data was collected by field interviewers. The sample size, the unweighted sample size, was 5,320. And then this was weighted, so again, for national representation. The survey was fully oral health survey, has a variety of domains, included about 156 questions on different topics, including HPV. We have used some of the questions around HPV topics, which we'll be sharing with you on the results of it, along with the social demographic variables and things like that. The HPV questions were related to oral health attitudes, behaviors, and perceptions about HPV vaccine and HPV among adults. Next slide. So here are some of the research questions that I'm going to share the data as we move forward, but to kind of set the stage, some questions were about knowledge. One about HPV and the second one about HPV vaccine. So the first one asking, how important do you think this HPV vaccine is for preventing cancers of mouth and throat? So very specific to oral health related one. The second question asked about, do you believe that HPV is linked with the oral health of your teeth, mouth, and gums? Those were the two knowledge-based questions. The next two were the perception-based questions, in which the adults were asked, like, do you think if dental providers are qualified to educate patients about the HPV vaccine? Because again, we don't know what do adults think about dental providers' role, and this was really an important part to understand where their perceptions lie. And then the second one asked, are you comfortable with dental provider discussing HPV and HPV vaccine with you and your children? As we know that dental providers in all states cannot administer HPV vaccine, only a handful, or not even handful, only Oregon has this a policy where dental providers can vaccinate for HPV vaccine, but so therefore the question was asked if adults were comfortable about discussing the HPV vaccine with them or their children. Next slide, please. And then the last question that we have included in this study was about adults' experience about dental providers' recommendation. So the respondents or the participants were asked if dentist or other healthcare provider has ever mentioned you getting an HPV vaccine, so as to understand, has there been that communication channel, has there been that discussion going on in between the provider as well as the patient. So going to the next slide, here are the demographics. The sample included about 52% female, 63% non-Hispanic white, 17% Hispanics. As you see, the education and income distribution is here, reflecting again a national population. Next slide. So now getting to the main part of it, what did we find using this data? So as you see, the knowledge question about if HPV is linked with the health of teeth, mouth, and gums, 91% people said they did not think that. They did not think that HPV was linked with it. So only 9% people made the connection between HPV and oral health. Huge, huge difference. When asked about if you have received, or if dental provider or any oral health provider has ever recommended or mentioned getting HPV vaccine to you, again, 95% people said no. And again, remember, as we mentioned, this survey was done in 2021. So it's pretty recent data in the early January and February of 2021. So 95% again said that they have not heard about or discussed HPV vaccine, or dental provider has done that. So keep these numbers in mind as we'll come back to them again. Next slide, please. So now thinking about these other questions about HPV vaccine importance. So asking about how important do you think human papillomavirus vaccine is for preventing cancers of mouth and throat? This was comparatively higher. We found that about 33% of adults said that they thought it was very important, and 46% said they thought it was somewhat important. However, there was this 21% of population, 1 in 5 people, who thought that it was not important or they did not knew about it. So again, HPV vaccine relation with oral cancer or cancer of mouth and throat was comparatively, that knowledge was more than HPV and its connection with oral health. Next slide, please. Here, we show the kind of distribution and stratification by different other categories, like, for example, in race, ethnicity, how did that importance question look like in different groups. We found that among males, it was those who said very important and those who said not somewhat important was about 81%. And among females, it was a little bit around the same, but the distribution was a little bit different in terms of very important and somewhat important. So some differences over there. But if we see in the race ethnicity, this red table that you see, those who said it was very important among white non-Hispanic adults, those who said very important, the percentage was comparatively much lower than other race ethnicity group. If you combine very important and somewhat important, it comes closer in all groups, but there are differences. And these perceptions about how important it is, somebody saying very important is different than somebody saying somewhat important. Again, in this graph, you'll see that among Black non-Hispanic and among Asian non-Hispanic, those who said very important, HPV vaccine was very important in preventing cancers of mouth and throat was much higher than any other groups. Next slide, please. So the next question was, do you think that dentists or any oral healthcare provider are qualified to educate patients about HPV vaccine? This was big. More than half of the respondents reported that yes, oral healthcare providers are qualified to provide education on HPV vaccine. We do hear that dental providers do understand the importance of HPV vaccine and do want to talk to their patients about it, but sometimes there's this hesitation because that's not the usual norm. And therefore, sometimes we have conducted some of the summits here in Virginia about HPV, and we have heard from providers that they think that probably their patients might not want to talk about HPV with dental providers. And so this question kind of gets to that, where adults are their perceptions about dental provider role, and they thinking if the dental providers are qualified to educate about HPV vaccine is strong. So more than half of them did think that yes, that should be, and they are qualified to provide education on HPV vaccine. Next slide, please. In this one, again, we are looking at the distribution by race ethnicity as well as by male and female. Here we do see some differences that males are more likely to say that dental providers are qualified to educate compared to females. And in this one, you see it's a little bit of flip where non-Hispanic white groups, pretty much all groups except Hispanic group are more are on the side of saying, yes, dental providers are qualified to educate. Only Hispanic group, if you see, they are lower than 50% and lower than other groups in terms of saying that yes, dental providers are qualified to educate patients. So this kind of gives us some idea of where these gaps are and which groups are kind of in the areas where probably we might want to understand more about them and see what kind of education is needed and what kind of, and we'll come to it again later as we discuss the models, but again, keeping this in mind that how there are differences by race, ethnicity, and by other social demographic groups in terms of thinking about the role of dental providers in HPV education. Next slide, please. So the next one, this one asked about, are you comfortable with either pediatric dentist or any general dentist or any other oral healthcare provider discussing HPV vaccine with you or your child? And again, here, the comfort level was high. When, again, as I mentioned to you, sometimes dental providers think that it would make it difficult to have this conversation and probably have this kind of thought that maybe this might not bode well with their patients. But from this survey, from this data, we see that almost 60% of adults, they said they are comfortable with discussing HPV vaccine with their dental care provider, with their oral health care provider, but then as well as for their children. So this is kind of, again, one of those positive notes. Next slide, please. In this one, again, we see the similar kind of differences, males being more likely compared to females in terms of being comfortable, which kind of is interesting, very interesting in terms of males thinking that yes. And then again, the racial ethnic kind of group here, we see that pretty much all the groups are kind of above 50% in terms of their comfort level. The numbers kind of change from group to group, but non-Hispanic Asians and non-Hispanic 2 days or more are much more likely to be more comfortable discussing HPV vaccine compared to other groups. Next slide. So those were kind of giving you some descriptive, some stratified differences between how people thought about these different comfort level, HPV vaccine importance, and provider being qualified to discuss HPV vaccine. What did they, adults, think? So these were our kind of main 3 outcomes. I'm going to now present the result of these 3 outcomes using regression models so that they are adjusted for other factors. And by including this information, kind of it becomes very clear that among people who either had education or kind of knowledge about HPV's linkage with oral health, as well as among people who had dental provider ever mentioned to them getting HPV vaccine, they were much likely, they had higher odds of saying that yes, HPV vaccine is very important. This model is kind of showing the result of logistic regression, and it's an ordinal model because we are having a very important, somewhat important, and not important outcomes compared to each other. But the idea, the main thing from the data point from this slide is that those who had knowledge about HPV and oral health connection, as well as those who had received the information about HPV vaccine from their dental care provider, were much more likely to kind of acknowledge the importance of HPV vaccine. There were other factors that were important, as we saw those differences in the stratified analysis by ethnicity, and then obviously metro region people, adults who lived in metro region were also more likely to kind of acknowledge the importance of HPV vaccine compared to the non-metro people. Next slide, please. This is a second model. So as I said, our first outcome, HPV vaccine importance. Our second outcome is dental. What do adults think about dental provider or oral healthcare provider being qualified to educate patient about HPV vaccine? The similar kind of pattern we see again here also. These 2 factors, if the HPV knowledge was good, and if they have received any recommendation of HPV vaccine from their dental care provider, they were much more likely, again, to think and to perceive that yes, the HPV, the dental providers are qualified to educate about HPV vaccine. So here again, the strength of association is very high. There were 3 times, had 3 times and 2 times more higher odds of agreeing to the fact and perceiving that yes, dental care providers are qualified. Next slide, please. Again, all these models are controlled for other variables. I'm just showing the highlights to you guys so that it kind of brings to the notice again that what factors are important in terms of when we think about where these perceptions and where are the areas where we could kind of improve these perceptions by kind of providing education, things like that. This is the last model. This is our last outcome where we're thinking about and answering the question if the adults are comfortable with discussing HPV vaccine with dental care providers. And same story and same results, the association strength changes a little bit, but every association we see is almost close to twice higher, which shows that the importance of these 2 variables or these 2 factors where HPV knowledge and discussion of HPV vaccine with dental care provider really changes the perceptions of adults in terms of their comfort, in terms of their thought about are dental providers qualified to educate about HPV vaccine, as well as their knowledge about HPV vaccine importance in preventing oral cancer increases tremendously. Next slide, please. So to tie this all up, as we saw all from this result slides, the knowledge about HPV and HPV vaccine with oral health linkage is low, because still people kind of think about HPV more as it was started in the beginning with cervical cancers. I still talk to some of the people, and kind of thinking about HPVs and its linkage with oral health is a leap, and therefore it's not very common, and we do see it in the data that knowledge is low. But the positive notes, as I said, is that more than half of the adults, in one case we saw that 56%, in other case we saw that almost 60% adults were very agreeable and very, they kind of said yes, that they think dental providers are qualified and should be involved in HPV prevention. Looking at the models result, we did see that the importance of the factors, HPV knowledge and dental provider recommendation shows up in all of the 3 models. And therefore, those areas become really strong, that we do understand that if those areas are updated and modified and educated, if the adults are educated about the relationship of HPV and oral health, there could be this trajectory where if that increases, then their perceptions about dental provider increases, then their knowledge about HPV importance, the vaccine of HPV, the importance of HPV vaccine increases. Next slide, please. So with this all information, I think the main thing is kind of thinking about all healthcare providers. Again, HPV and oropharyngeal cancers has been happening, but in recent years, there has been more understanding about it. There has been more policies and more changes in terms of now HPV vaccine is recommended for prevention of oropharyngeal cancers also. Earlier, it was mainly marketed as a cervical cancer vaccine, but now as the knowledge grows, as the data grows, now we know more. However, probably our patients and our populations have not yet catch up to that, and therefore there's more work to do for us, for healthcare providers in general. From thinking about a dental care provider standpoint, there's a huge reach. More than 2/3 of the population visit dentists per year, and similarly, there's a huge reach among other healthcare providers, where a strong number a huge number of population is visiting. So discussing and talking about HPV vaccine at those visits is really one way to improve knowledge and education among the patients. Effective communication and messaging, similar messaging, so that patients are not confused, but kind of hear the same message from all healthcare providers in terms of what is HPV, what do HPV vaccine prevent? They prevent cervical cancer, they prevent oropharyngeal cancer, they prevent another 4 types of cancer. But if they don't know all the story, then they would have half knowledge. So effective communication and strategy so that it can build patient awareness, and the patients are more aware of all the risk and all the benefits related to HPV vaccines and its importance in cancer prevention. HPV is one of those topics, like I am very interested in medical dental integration, and I feel there is mouth is not different than oral health, and you all know and do the work in this area. So I think that portion needs to be made sure that patients also understand that it is not one, like all the information again from dental care providers and from oral health, from other medical providers need to make that connection that yes, if you are the HPV vaccine would prevent and improve oral health as well as overall health and its overall cancer prevention. HPV and OPC, again, oropharyngeal cancer information. So on dental side, what we can do, and I think on the primary care side also, the same thing needs to happen, that where dental care providers are talking about HPV vaccine, they're not only talking about oropharyngeal cancers, but in addition to oropharyngeal cancer, all that could happen. or all the cancers that it could prevent, and same thing for the primary care. And then another kind of call to action would be the education improvement, where as we know and as we grow, as the evidence increases, integrating this knowledge and information about HPV and oropharyngeal cancer connection should be integrated into the curriculum, where in the practice also it is taught, and also in the educational curriculum of both medicine and both dentistry should be kind of shared with the providers, so providers feel more confident, are ready to kind of share this information with their patients. Next slide, please. So as I shared, oral healthcare providers, there are a variety of things that could be done to close the gap, starting from promoting oral health oral cancer screenings. It's a very right opportunity to talk about when the routine exams are happening and oral cancer screenings are happening, to talk about HPV vaccine, so that it's not one odd conversation, but it's a conversation about health, and it's conversation about promoting oral health, and kind of discussing about what are the prevention methods available. Sharing about HPV vaccine with parents and caregivers, asking about vaccination schedules. These could be other things that could be integrated into oral health settings, where it becomes more of a norm rather than, again, kind of something different is being done at one provider, but kind of it's a more normal way of caring. Promoting integrated healthcare model, and definitely more research as more and more work comes out, and that evidence-based research is picked up, kind of using those methods and approaches in day-to-day patient care, so as to increase the confidence among the patient as well as among the provider in terms of discussing HPV vaccine and HPV related relation with oral health in an everyday kind of setting. Next slide, please. So we kind of talked about this, and again, kind of this is another reminder of what different kinds of things can be done for dental care providers. Definitely kind of educating ourselves in terms of knowing what is the new information, what is the correct information, doing proactive approaches, attending like you all are today here, kind of knowing about what is going on in this area. These all are important in terms of strategies for change. It doesn't need to happen all of a sudden and all together, but slow and small steps could lead to kind of these changes. And slowly, as you're more aware of it, it could be brought into practice and kind of be used in a regular settings of patient care. Next slide, please. Again, there are now slowly as the more information is coming out, and then as we see from this data, dental healthcare providers are really important part of the whole health providers kind of group, in which we are thinking about oral health in together with overall health, and therefore can play a very important role in prevention of oral HPV, and definitely all the consequences related to it. It is important to, again, become familiar with all this new work that is going on, all the new information that is coming in, and understanding and knowing where all this information comes together. In the next slide, we'll show some of the information that is already available from organizations such as American Dental Association, American Academy of Pediatrics, Centers for Disease Control and Prevention. There's a national roundtable for HPV prevention, which also kind of provides very specific guides for dental care providers in terms of how to even discuss, how to initiate conversations, things like that. That could be very helpful in terms of anybody who is starting to think about making changes and kind of applying it in their practice. Next slide, please. So here are some of the links that could be used in terms of understanding and answering questions about HPV vaccine. It's a guide for dental professionals put out by AAP, different kind of questions and key points that dental providers should be knowing about HPV and can use it in their discussion. So please, there are a lot of resources. We are sharing some here, but definitely AAP, CDC, and ADA, these have been compiling and synthesizing the evidence together so that dental providers can have it at one place. Next slide, please. This was another policy that American Dental Association has adopted, again, in terms of thinking of administration of HPV and supporting dentists in doing the administration of HPV. This was done in 2018. And then again, from the data, not only actually medical data strongly suggests that dental provider or any healthcare provider recommendation is one of the most important factor in improving vaccination rates. And therefore, the same thing we have in terms of that ADA has also kind of recommended that providing a recommendation from a trusted healthcare professional is very important. Next slide, please. So, so in terms of some of the other things that are on the next slide are about legislation and other things. We have about 8 minutes in there. So I am going to kind of leave this up here, but as I had already mentioned that there are some states which have already passed the legislation to administer HPV vaccine. Some work is going on, obviously, with COVID vaccination and other things. Things have changed and have taken pace. So there are things happening at local level in variety of states, but variety of, again, different things that could be done, and keeping up to date with them would be an important area, again, in terms of how once we think about engaging into this HPV conversation and working together with all other healthcare providers. Again, we have 8 minutes left, so we'll go to the discussion and questions and open it up for that. But thank you so much for having us and letting us share some of the work and provide some information about the HPV and HPV vaccine to you all.
Okay, thank you, doctors. That was so informative. I know me personally, I thought we had made more traction in this. And so I was really disappointed to hear that Texas is ranking 47 out of the 50 states. I have a quick question for you. And also somebody had asked a question about having the slides. The doctors will send a PDF of the slide deck to us, and we'll have that posted on our website for anyone that wants to see the hard copy of that. Do y'all have the percentage about where Texas is? I mean, you said 47 out of 50 states, and I remember you saying that the goal nationally was for everybody to be at 80%. What is our percentage? El Paso may have broke the curve on that.
El Paso was 66% and the others were less. So not quite at the 80%, but I want to say it was close to 50, the average for the majority of the counties, but 66%, Beth, was for El Paso County.
Okay.
Do you by chance know, Beth, what is being done in El Paso County?
As a matter of fact, I do. I am so
wonderful.
glad that you asked. Yeah.
Can you share that, please?
Yes, I'd love to. I gave a presentation in El Paso a couple of years ago, and one of the other presenters was a pediatrician there, and they made a huge effort on getting all of the doctors to talk about HPV to their patients. And because the Hispanic population, that culture really believes that the doctor knows the most. And so if that information is coming from the doctor, they will go and do it. So that information was shared from the pediatrician or their family doctor to parents about, you must go get your children vaccinated, please do this. And that's why they got up to that 66%. It was the medical doctors in that community. Isn't that outstanding?
Yeah, that is wonderful. Thank you for sharing that. I think we should all take that to heart and work with our pediatricians and primary care physicians to educate our community.
Absolutely.
Yeah, definitely. And it again kind of says the same point that provider recommendation is one of the strongest one in terms of improving vaccination rates.
Right, and we've even heard from different campaigns that we've done where we've done these types of surveys, and it always comes back to the medical professional is the first. That's the primary person they listen to, and then the dentist. So it doesn't surprise me to see a little bit difference there. I noticed that the Hispanic population was a little lower in believing those dentists, and I'm just wondering if it's like an overall impression that people have that dentists aren't really doctors, you know, they're just teeth people and not overall health. So I'm wondering if that might have something to do with that.
I know, Beth, this is Christina. I know in our dental clinics, they believe that we only treat teeth or hard tissue, not necessarily the rest of the body. So I think there's a lot of room for improvement to let them know we do tie in systemic health to oral health. But
Right.
it's trying to educate our patients.
Right.
Yeah, exactly. Because I think this kind of shows a snapshot of the whole nation. And therefore, I think it definitely, this cultural differences between how people think about different group of providers and trying to make that connection of oral health and overall health in it, like patients know about it, we know about it, but do patients know about it becomes really important.
Exactly. Is there anyone else that has any questions? If you want to raise your hand, we can unmute you, or you can put it in the chat box.
Beth, there's a question from Charles in the chat box.
Okay.
I'll read it. It's with the creation of education materials about HPV and oropharyngeal cancer. Is there any information about how often oral healthcare providers offer this material? I'll offer some input, and then Dr. Naval, if you want to tie it in. So Charles and attendees, there really is no best practice on how often we do it, but just like we do any other type of updates in a clinical setting or community setting, it should be as often as we need it. So let's just say if you notice that the medical history form did not document that they've had an HPV vaccine, then we have that discussion. Just like if you know that they're using tobacco, we have the discussion about tobacco and cancer. So it's more of those, let's do it upon medical history. What I tell our students, because I do a lot of the risk-based education, at every interval, if they come in for a recall visit, if they come in for a hygiene visit, if they come in for their annual periodic eval, whatever it might be, that's when we have the discussion. But if we don't capture it in the medical history, we won't know if they've had an HPV vaccine or any other vaccine. So in our medical histories, we do ask about vaccines that kids need to go to school, but we also have to start asking the vaccine, have they had an HPV vaccine and are they fully immunized? So it's just something we have to do within our medical history. But I'll turn it over to Dr. Naval to see if you want to add on.
No, I totally agree. In terms of like, we don't have good data. Again, as dental providers are now kind of getting up towards this HPV prevention program and kind of we are understanding more and more from the evidence, but we do not have any set protocols for the HPV vaccine prevention or counseling or documentation. And so therefore, I think it is important to move in that direction, just like how we are now thinking about the codes and the counseling kind of information so that we can capture that information. But to again answer to your question, we do not have data on how often it is done. It is right now pretty much varies depending on how providers are engaged in different areas and how much someone is doing. So no national data on that.
Well, I appreciate you all sharing some of the information about some action steps that we can do either as dental providers, but also for those of us that like coalitions or nonprofits, what can we do to encourage? And that would be sharing some of the information, those infographics from AAP or ADA or any of those 4 sources that you put up on a slide. And we'll have that link available for each one of those after the presentation. But I'm wondering if there's anyone that's doing any kind of social media messaging in English and Spanish, specifically Spanish. Evidently, we need to make especially in Texas, we need to make a a point of really trying to communicate with Spanish-speaking individuals to educate them about HPV. Do you know of any that have any of those types of messages?
Beth, this is Christina. When we were working with Immunize Nevada, the statewide immunization coalition, we had developed something a few years ago when they had CDC funding. But what I've noticed is they do have it now capturing COVID vaccines. So it's in English and Spanish, their dashboard. Let me see if they actually still have it for HPV. I think everybody now has shifted towards COVID vaccines, and HPV kind of went on the sideline, so to speak, but I do know that they do capture English and Spanish perceptions and educational material on an online dashboard. So let me see what I can find and I can share it with you.
Okay, that would be very helpful. And then my last point was, I'm just wondering if the COVID vaccinations, all of this is now all about COVID, if that's kind of hurt our HPV, or if people are just overwhelmed with vaccinations and don't want to hear it anymore about it. But I really feel like we need to bring this to the forefront again.
Yeah, no, definitely. I think with the current situation, definitely all the childhood vaccines rate have gone down than before because of the vaccination kind of in between the COVID pandemic and other reasons of it, because of which it has gone down. But definitely, I think social media and those kind of interventions could really work great. Similarly, in Virginia, the Virginia Department of Health and Virginia HPV Immunization Task Force has used the different social media messaging and Twitter accounts and things like that to share with that. So I think that's a great idea as a coalition to kind of share those things.
Well, you doctors have lit a fire under me, so I'll get back on it and really kind of bring that to our top 3 things that we're going to be pushing this next year. Thank you both for such an informative, and I love the survey information. That was just so informative. Thank you so much for presenting for us today and giving us this information. We appreciate it. Thank you both again. Thank you, attendees, for spending time with us today. And we hope you all have a pleasant weekend.
Thank you. Have a nice weekend.
Thank you. Bye-bye.